Bawat lugar sa ating bansa ay patuloy pa rin lumalaban sa COVID-19. May mga rehiyon na pababa ang trend ng mga kaso. Pero sa Kabisayaan, ang datos daw ay hindi tumataas pero hindi rin naman po bumababa. Ibig sabihin plateau. Ating pong kumustahin ang buong Visayas Region at ang mga hakbangin na ginagawa ng pamahalaan upang ingatan ang mga residente doon. Makakasama po natin muli si General Melquiades Feliciano, ang IATF Chief Implementer sa Visayas. Good morning po, General.
Morning sa iyo, Yusek Rocky, at good morning sa tagapanood ng PTV Philippines.
Opo. General, inaasahan po ba yung pagtaas ng mga kaso ng COVID-19 sa Visayas, partikular na sa Negros Island na sinasabi po ng ilang medical doctors doon na magiging malala di umano ngayong kaligitnaan ng Oktubre? Gaano po kaposible ito?
Well, let me explain that by region, Yusek Rocky. Kasi yung mga pagtaas ng mga cases, if we will be considering the whole Visayas, is through regional mga data, because these are group of islands. Now, let me start with Region 7 muna. Sa Region 7, actually, yung rise ng Region 7 started in the first week of July and it peaked in the second week of August. So 1.5 months siya nag-peak, no? That time, during its peak, umabot ng 70% ang capacity utilization rate ng mga private hospitals natin. But considering that these are only accounting for the COVID beds, yung staffing noon kulang. So it's actually reached on the critical level as far as the healthcare workers are concerned. Now, ang sitwasyon naman ng Central Visayas, since last month, on the first week of September, dahan-dahan na siyang bumaba. So ngayon, ang cases mababa na, manageable siya, and the CUR now of the private hospital is at 26.8%. So stable na itong ang Central Visayas. So hopefully we can maintain it with the strong COVID response sa mga community. I believe that this could be maintained, no? Now, punta naman tayo sa dako ng Western Visayas na dito talaga it started the rise probably a month ago, no? From the previous rise 3 months ago, nag-rise siya ulit because probably this is now the effect of the Delta variant as the dominant variant in the region, no? Particularly Bacolod City, Iloilo City, and the province of Iloilo. Now, sa ngayon, actually, nagpipik sila ngayon sa kanilang cases, but I confident sa meron silang mga established COVID response plans, particularly ang Bacolod City. So, and they are now mobilizing all the efforts that they are having there. So, ang trend yan is after the peak, they will be able to manage it, no, control the spread. And I'm expecting probably in the coming weeks or even a month, we will expect actually lowering of the statistics ng area. Now for Eastern Visayas, Region 8, actually ang Region 8 hindi siya masyadong affected, no? For the reason that yung transmission kasi depends on the setting, no? Just like Region 7 and Region 6, they have highly urbanized areas where there are many economic activities, maraming gatherings, no, maraming movements. So ang increase ng mga statistics ng mga cases ay mas mabilis compare natin dito sa Region 8, no, where ang medyo cities na malalaki doon are Tacloban City and Ormoc City. That's why ang Leyte, Southern Leyte, siya yung may matataas na kaso. But compared to the other regions, mas mababa pa rin siya. So I think, I believe na in the coming weeks, pwede nang ipababa ng mga regions ang kanilang mga kaso.
Opo, pero General, bakit daw po nag-plateau yung kaso sa Visayas?
Well, actually, ako personal experience ko rin ito. Iba kasi yung pag-treat ng Delta variant, no? Mahirap siyang i-manage, mahirap siyang i-control yung spread compared to the previous last year SARS-CoV-2 natin na ordinary variants or virus. and also the P3 that we have experienced here, no? Medyo mahirap talaga itong i-handle. That's why there's a certain point na magpa-plateau siya until such time na if continuous yung implementation ng mga protocols natin at ma-shape yung behavior ng mga tao on how to really be following the right protocols, dun natin siya makikita na bababa siya because the transmission is always closely related to the behavior of the people.
Opo, pero General, kung sakali lang po, kung sakali man po na lumala ang mga kaso ng COVID-19 sa bahaging yon ng Kabisayaan, masasabi niyo po bang ang LGU ng Negros Island ay nakahanda? At anong tulong po ang handang ibigay ng iba pang mga probinsya sa kanila?
Well, actually, sa ngayon, ang Negros, they are recruiting, the O86 is recruiting nurses, additional nurses para sa i-augment sa mga hospitals nila, including the TTMF. No? And yung Region 7 actually tumutulong din naman sa Negros Island, yung mga convalescent plasma and other assistance na binibigay naman. Plus, we also continuously monitoring their activities. No? Yung mga private doctors ngayon doon, they're having in their group chat on how to really treat those patients, especially the mild ones, para hindi na sila mag-progress into moderate or up to critical level. So maraming measures na ginagawa. No? The LGUs are there and the government agencies, they are one in hand. No? They are dealing with this crisis.
Opo, General, 90% po ng mga nagkaka-COVID-19 sa Negros ay mga unvaccinated individual. Dahil po ba ito sa kadahilan ng ayaw magpabakuna ng mga residente o dahil po sa kakulangan ng supply ng bakuna?
Well, unang-una, as of late, the previous week, ang Negros, hindi siya na isa sa mga priorities ng national. No? So that's why yung mga vaccines na bigay sa kanila are still lacking. No? So isang reason yon. Plus, of course, meron din tayo mga tinatawag na hesitancy stage sa mga tao where we really need to make efforts to convince them. But now, since the vaccines are arriving now in volume, I believe for this month, every LGU in fact, in the whole Visayas will be given enough vaccine for their job administration.
Opo. Sa ibang balita naman po, General, isa po ang Cebu Island sa pilot area sa magkakaroon ng rollout ng mga bakuna kontra COVID-19 para po sa mga batang edad 12 hanggang 17 years old ngayong buwan. Maaari niyo po bang ilahad sa publiko ang detalye tungkol dito?
Well, actually, we anticipated that by requiring the Metro Cebu LGUs to have a master list on their pediatric category. No? These are the 12 to 17 years old na kabataan natin. And in fact, kung may ibang LGU na, kagaya ng Naga City, 100% na yung kanyang master list sa mga 12 to 17 years old na mga bata in preparation for the vaccination, probably in the midst of this month if the national government will allow. So we will be doing it to this pediatric group, no? And as of now, actually, all the LGUs of Metro Cebu are having their master listing on the 12 to 17 years old pediatric group.
Opo. Sa kasalukuyan po ba, ilan po ang kabilang sa inyong lugar dito sa tinatawag na pediatric population?
Well, at the average, mag-average lang tayo for the LGUs. The 12 to 17 years old accounts to the 12% of the whole population. So Metro Cebu has, or the whole province of Cebu has 2.7 million. That's why we are expecting to have 324,000, the 12 to 17 years old vaccines.
General, kayo po ba ay nakonsulta ni Governor Gwen Garcia sa pag-alis po ng swab test requirement sa mga pupunta sa Cebu? Pabor po ba ang IATF dito at tingin niyo po ba sapat na yung medical certificate bilang travel requirement?
Well, actually, si Gov. Gwen Garcia has always a plan on how to open or steer the economic activity in the province, particularly tourism, no, as one of the major economic activities here in Cebu province. That's why when she assessed that the situation, no, can accommodate anyone, no, probably without requiring, because we have this what we call the community response in place. So she's always trying to balance, no, the health and economy. That's why in her assessment, yung pagbukas sa border ng Cebu Island will help in the economic recovery of the different businesses dito. And sa tingin ko naman, yung medical certificate, of course, it's the responsibility of course to really have a correct assessment on each individual that will go to travel. And it's a sort of giving empowerment to the doctors to really help in our pandemic response.
Maraming salamat po, General, sa inyong pagbibigay balita sa sitwasyon dyan sa Visayas. General Melquiades Feliciano, ang Chief Implementer ng IATF-Visayas. Mabuhay po kayo at stay safe, General.
Maraming salamat din, Yusek Rocky, at sa lahat ng tagapag